स्टार्ट हो गया. Hi guys, welcome to this session of surgery questions. We are going to discuss the questions from PrepLadder QBank 6.0. If I'm audible and visible, please send your thumbs up in chat box. Now audible guys? Audible now? Audible and visible? Okay guys, so let's start. So experience QBank 6.0, the only matter that matters. Here you will be getting 18,000 MCQs including clinical scenarios. The questions will be in the dual format, so you can ace both clinical as well as one-liners. And here explanations are provided for all the options, whether it's correct or incorrect. So explanations are provided for all correct as well as incorrect options. There is learning objective for the key takeaways, and they will be tagged video lectures and treasures. Okay guys, so let's discuss the first one. See the question. A 50 years old female presents with complaints of heartburn and regurgitation. Clear guys? She also says that she feels postprandial fullness. A barium swallow reveals upward dislocation of both cardia and gastric fundus. Which type of hiatus hernia does this belong to? So in this case, there is upward dislocation of both cardia as well as gastric fundus. Guys, tell me what is the correct answer. What is the correct answer? Yashwant Rao, Aditya Singh, very good. Nidhi, Priya Saha, Keshav Gupta, Samir Khan, Maggie, Surabhi Mishra. Okay. So guys, majority of you are correct. What happens whenever there is herniation of both cardia and fundus? Obviously, which type of hiatus hernia is this? It is type 3. Which type of hiatus hernia? It is type 3. So see, what are the types of hiatus hernia? It's very easy to understand the types of hiatus hernia. In this image, you can see, this is the diaphragm. Guys, this is the diaphragm. You know that both GE junction as well as fundus, this should be located below the diaphragm. You can see, this is GE junction and this is the fundus. So both GE junction as well as fundus, it should be located below the diaphragm. Whenever there is only herniation of this GE junction, it is known as sliding hernia. And whenever there is herniation of fundus by the side of esophagus, what happens? This is known as paraesophageal hernia. So guys, in this image you can see what is type 1. In this image you can see, if there is only herniation of this GE junction, this is known as sliding hernia or type 1. So what is the name? This is known as sliding hernia or type 1. In the second image you can see that there is herniation of only fundus. So whenever there is herniation of fundus, this is known as rolling hernia or true paraesophageal hernia. Clear? So this is rolling or true paraesophageal hernia. If you see this type 3, in the type 3 you can notice here that there is herniation of both fundus as well as GE junction, and this is known as mixed paraesophageal hernia. So type 3, and this is type 4, where apart from herniation of fundus, there is herniation of some other organ. So apart from herniation of fundus, if there is herniation of small bowel, that is type 4. So question for all of you guys, tell me which is the most common type of hiatus hernia? Out of type 1, 2, 3, 4, which one is most common type? Type 1, 2, 3, 4, which one is the most common type? 1, 2, 3, 4, which one is the most common type? Guys, tell me. Type 1, yes. So it is sliding hernia which is most common type. Clear? But you know that in sliding hernia there is no herniation of fundus. So it is not the paraesophageal hernia. 2, 3, 4 are paraesophageal hernia. Can anybody tell me what is the most common type of paraesophageal hernia? Guys, tell me. Most common type of paraesophageal hernia. Prashant, Umesh, Dr. Sanjay, Injmamul Haq, Dr. Healer, Mahendra Bishnoi, Peace, Khan Samir. All of you are correct, guys. Now tell me, what is the most common type of paraesophageal hernia? Anuj, Vivan, first person to reply Vivan. After that Anuj, Anil, Sanjay Kumar, Rajat, Mahendra Bishnoi, Priya Saha. So guys, all of you are correct. Clear? So most common type of paraesophageal hernia, it is type 3. Type 3, this is the most common type of paraesophageal hernia. Most common type of paraesophageal hernia. Okay guys. Now see the next question. Tell me what is the correct answer here guys. 40 years old female comes to OPD complaining of abdominal pain. Where? In left lower quadrant. What is the age? 40 years old female for 2 months. It is associated with flatulence, lower abdominal heaviness, nausea and fever. On examination, deep tenderness and a mass was present in the left iliac quadrant. Colonic examination shows thickened intestinal wall. Barium enema, can you see guys, this is the catch. On barium enema, there is sawtooth. What is the diagnosis? Only on one feature you can make the diagnosis guys, only on one feature. Tell me, what is the correct answer here? Anuj, Saika, Praveen, Rajat, Urvashi, Sachan, Peace, Midlife, Priya Saha, Vineet Kumar, everybody is correct guys. So you can see here, in the left lower quadrant there is pain, there is tenderness, patient is having fever, some kind of inflammation must be there. So obviously, what is the problem? Patient is having colonic diverticula. Age, it is seen around 40 to 50. Clear? Around 40 to 50. Why? Because there is constipation. So patients are having colonic diverticula, and you know what is the investigation of choice for diagnosis? Guys, what is the investigation of choice for diagnosis of colonic diverticula? It is barium enema. So barium enema, it is the investigation of choice for diagnosis. Clear? And what is the appearance? Guys, you can tell me. You can see here the appearance. If you see the appearance, this kind of appearance, this is known as sawtooth appearance. Can you see guys? This is what you can see here. This is sawtooth appearance. So this kind of appearance, it is sawtooth. So you can see here sawtooth appearance. In the second barium enema also, you can see this appearance. Clear guys? So what kind of appearance is this? This is sawtooth appearance. This is one of the frequently asked image-based question. So in colonic diverticulosis, there is sawtooth appearance. Now one question for all of you, tell me, what is the investigation of choice for diagnosis of colonic diverticulitis? Guys, for diverticulitis, what is the investigation of choice? Waiting for your reply. Waiting for your reply. Yes? Soumya, ASGL Soumya, Rajat Bhaumik, very good. Nidhi, first person to reply correctly, Nidhi. CECT, Vivan CECT, Shipra CECT. Guys, it is CECT. Why? Because what is the problem? Yes, suppose this is the diverticula. In the diverticula, there is perforation. So actually speaking, these patients is having peridiverticulitis. Diverticular perforation, it causes inflammation around the diverticula, and that's why what is the investigation of choice? Investigation of choice for diagnosis, CCT. So you have to remember, for colonic diverticulosis, investigation of choice, barium enema. For diverticulitis, it is CCT. Clear? Diverticulitis, it is CCT. Diverticulosis, it is barium enema. Okay guys? So what is the correct answer here? The correct answer for this question, it is A, that it is colonic diverticula, right? Somebody marked Hedges syndrome. Guys, Hedges syndrome, what is the problem in Hedges syndrome? Hedges syndrome, how to remember? Mnemonic is SK. In Hedges syndrome, the patients are having aortic stenosis. There is acquired coagulopathy. These patients are having aortic stenosis. There is acquired coagulopathy. And these patients are having, yes, patients are having what? Angiodysplasia. And because of angiodysplasia, what's the problem? These patients are having anemia. Clear? What is the problem in FAP? In familial adenomatous polyps, how many polyps are there? Guys, more than 100 adenomatous polyps. More than 100 adenomatous polyps. But these polyps are within the lumen, so there is no sawtooth appearance. In ulcerative colitis also there is no sawtooth appearance. In ulcerative colitis there is involvement of rectum, after that colon, but sawtooth appearance is not there. Okay guys, so sawtooth appearance is not there, right? So everybody is correct guys. Correct answer is colonic diverticula. Now tell me, what is the correct answer here? Easy question guys. Which of the following is characteristic of omphalocele? Omphalocele found in a newborn. I'm waiting for your reply guys. Tell me. Omphalocele found in a newborn. Yes, this is both for NEET PG and FMG guys. Questions are for both. And nowadays, you know, the conducting body is same, NBE for both FMG and NEET PG. That's why there's quite overlap of questions. Yes, everybody, Unnati, Rinku Sharma, Amber, Saika Dwar, Praveen Kumar, Surabhi Mishra, Medlife, Ninja, Vivan, Divya, Navneet, Umesh Kumar Yadav, all of you are correct, guys. All of you are correct. Now let us discuss omphalocele. First, see how it looks like. In omphalocele, guys, you can see here, it is covered by what? Inner layer is peritoneum, and what is the outer layer? Yes, outer layer is amnion. So guys, it is covered by outer layer amnion and inner layer is peritoneum. So how to remember, guys? It is peritoneum which is in. So how to remember? Pin. Peritoneum is in. Clear? Important point, why omphalocele is having poor prognosis? Because it is associated with congenital malformations. Can anybody tell me in the comment box what is the most common congenital abnormality seen in omphalocele? Guys, tell me, I'm waiting. Most common congenital abnormality seen in patients of omphalocele. Tell me, most common. Rahul, yes, for INI-CET also. Most common. No. Guys, tell me what is the most common. First person to reply correctly, Soumya, ASGL Soumya. It is cardiovascular, is the cardiovascular malformation that's most common. Clear? You can see here, this is gastroschisis. Can you tell me, guys, what's the problem in gastroschisis? In this image, you can see that there is splitting of abdominal wall on the right side of umbilical cord, and there is herniation of bowel, and you can see here it is exposed. So here the bowel is exposed. Because of this, intestinal complications are more common. So in this patient, you are going to find intestinal complication like intestinal atresia. And let me tell you, guys, every year in each and every paper this question is asked. Either omphalocele or gastroschisis, every year in each and every paper. Clear? So this is omphalocele and gastroschisis. Can you see, guys? Clear? So see the question again. It is not covered by sac. Not covered by sac in which condition? Gastroschisis. Clear, guys? A defect in abdominal fascia. No, there is no defect in abdominal fascia. What's the problem? The bowel fails to return. To abdominal cavity in omphalocele associated with intestinal atresia. It's the gastroschisis which is associated, and it is associated with, guys, can you see? Associated with what? Congenital abnormalities. Yes. So omphalocele, it is associated with congenital abnormalities. So here, what's the correct answer? The correct answer is D. Clear? It is associated with congenital abnormalities. I'm repeating that we are expecting questions from omphalocele and gastroschisis in upcoming exam. Okay, guys? Next, tell me, this very easy question, what is the correct answer? Which of the following is not a risk factor for squamous cell carcinoma of esophagus? Not a risk factor. Easiest question. Tell me. Easiest question, guys. Easiest question. Not a risk factor. Yes, Pankaj Agarwal, Yashwant Rao, Soumya, Aditya Singh, Praveen Kumar, Ritika, Nidhi, Vineet Kumar, Jayanti Rai, Puneet Shah, Maggie, Rashi Gupta, Urvashi, Medlife, Sareem Ali, Shalini, Seh Shahid, Rajat Bhaumik. Everybody is correct. Guys, see. Two malignancies, squamous cell carcinoma and adenocarcinoma. How to remember? Squamous cell carcinoma, usually it is more common in low socioeconomic status. Adenocarcinoma more common in high socioeconomic status, exception carcinoma stomach. Carcinoma stomach is adenocarcinoma. Despite of that, it is more common in low socioeconomic status. But in esophagus, squamous cell carcinoma more common in low socioeconomic status. Adenocarcinoma more common in high socioeconomic status. So one of the most important risk factor for adenocarcinoma, that is GERD. What's the risk factor, guys? It is gastroesophageal reflux disease. So anything which promotes reflux, like obesity, like high fat diet, clear? Patients who are suffering from Barrett's esophagus or scleroderma, all of these are risk factor for adeno. These are the risk factor for adenocarcinoma. Clear? What are the risk factors for squamous cell carcinoma? For squamous cell carcinoma, alcohol, smoking, human papillomavirus infection, caustic injuries. Clear? All these are the risk factor for squamous cell carcinoma. So obesity, this is the risk factor for adenocarcinoma. Clear guys? Obesity is a risk factor for adenocarcinoma. Okay. Next. Tell me guys, it's very easy question. Which of the following is true regarding spigelian hernia? Easy question. Let me see who is going to reply this question correctly. Easy question. Let me see who is going to reply this question correctly. V1, alcohol doesn't cause GERD. Alcohol is going to cause the relaxation of LES. If alcohol is going to cause the relaxation of LES, patient will not develop GERD, patient develops reflux. So whenever there is action of alcohol, suppose you take coffee, you eat chocolate, you take alcohol, you smoke, all these are going to relax the LES. So it is going to decrease LES pressure. So patient will be having reflux on that day. Clear? It doesn't mean that today you are going to consume alcohol and after 3 days there is reflux. Got it? So it is not GERD, it is decreased LES pressure, because of that there is reflux symptoms. I hope you are clear now. Okay. So guys, tell me true statement regarding spigelian hernia. Yes. Let me see. Payal, Urvashi, Sachan, Jayanti, Rai, Bittu Mishra. Yes. Devika. Clear? So majority of you are correct guys. Now see. Exclusively, which hernia is exclusively more common in males? Exclusively means majority of the patients are males. Which hernia, can you tell me? Yes. Which hernia? Guys, it is sliding hernia. So sliding hernia, it is almost exclusively seen in males. It is sliding hernia. Right? Okay guys. Now see the option. Involves part of circumference of the bowel wall. Tell me guys, what's the name of this hernia? Whenever there is hernia involving part of circumference of bowel wall, can you tell me what's the name? Waiting for a reply. Let me see who is going to reply correctly. First person to reply correctly. I'm waiting. Part of circumference of bowel wall. Rashi Gupta is the first person to reply correctly. Ritika Chaudhary, Bablu Yadav. Very good. So it is guys, Richter's hernia. What happens in Richter's hernia? There is herniation of part of circumference of bowel, and usually it is associated with femoral hernia. Now option C, best repaired by classical Bassini's technique of inguinal ligament repair. Bassini's is also known as triple layer repair. It is having high recurrence rate. So this is not done nowadays. And what is the fourth option? It occurs at the lateral edge of linea semilunaris. Actually speaking, this is correct. Clear? So first see what is spigelian hernia. In this image you can see there is herniation through spigelian fascia. What is the location guys? It is herniation through this spigelian fascia. This is the spigelian fascia. You can see this is the arcuate line. So what is the location? It is located at or below arcuate line. In Bailey it is wrongly written that it is located above arcuate line. What is the location? At or below arcuate line. Where exactly? Yes, exactly at the lateral border. So what are the boundaries? You can see this is rectus abdominis and this is the semilunar line. So in this region, this spigelian hernia is going to occur. It is also known as interparietal hernia. What is the big problem? It is neither visible nor palpable. That's why for diagnosis you need ultrasound or CT. Clear? So there is delay in diagnosis. You need ultrasound or CT. Very good. Wasim already told us that ultrasound is done for diagnosis. So this is spigelian hernia. So guys, what is the correct answer? See the location. It occurs at the lateral edge of linea semilunaris. Clear? Lateral edge of linea semilunaris. Okay. Next question guys is very easy. Read it. Very easy to understand. Read the question. 80 years old female admitted to hospital for severe fatigue after minimal exertion for 2 years. Can you see the hemoglobin? Very low, 5.7 milligram per deciliter. Transfusion was initiated. Hematological profile showed iron deficiency anemia. Normal bone marrow, fecal occult blood testing FOBT, it was also positive. Upper GI endoscopy and colonoscopy was performed. Can you see guys? There is non-hemorrhagic angiodysplasia in the cecum. Echocardiography, can you tell me? There is severe aortic stenosis. Mean pressure gradient, 62 mmHg, probable diagnosis. Yes, now everybody is marking the correct answer. Everybody is correct, guys. Obviously, it is which one? Hades syndrome. And we discussed how to remember Hades syndrome. Hades syndrome, very easy. Mnemonic is SCA. So this is what, guys? This is Hades syndrome. Hades syndrome, and this is SCA. SCA. So what is the full form? AS, that is aortic stenosis. C, patient is having acquired coagulopathy. Normal bone marrow, so there is acquired coagulopathy. A, angiodysplasia, so there is anemia because of angiodysplasia. Guys, anemia because of angiodysplasia. So what is the correct answer here? Everybody is correct. Guys, this is what? This is Hades syndrome. So what is the correct answer here? It is Hades syndrome. Okay, everybody is correct. Actually, this question was asked many times in All India. Hades syndrome. Next question. Let me see who's the genius over here and who is going to reply this question correctly. Fastest reply I'm expecting. 65 years old man. There is episode of syncope, feeling dizzy during defecation, seeing gross blood in the toilet for a month. There was aortic stenosis on echocardiography. Colonoscopy reveals small, flat, cherry, fern-like projecting vessels originating from central artery. Can you see the appearance? It's something like this. Clear? Guys, be careful. There might be two questions similar in the exam, and it's a history that sometimes in NEET PG and INI-CET, they repeat the exact question in the exam. So it's not necessary that 2 times the same answer can't be correct. Okay? Let me check how many of you are going to reply this question correctly. First person, Priya Saha, Rajat Bhaumik. Priya Saha, Rajat Bhaumik. Vivan. Very good. We discussed this question just now. What's the problem? Aortic stenosis. And what is that cherry-like, fern-like projecting vessel originating from central artery? This is the appearance of angiodysplasia. There is a central artery and what you can see, cherry red fern-like projecting vessel from this central artery. So this is actually angiodysplasia. Angiodysplasia. So what are the problems? You can see here, guys. Patient is having aortic stenosis. Patient is having coagulopathy. Patient is having bleeding leading to anemia. What's the cause? Angiodysplasia. There is angiodysplasia. Clear? So what is the correct answer? Same, Hades syndrome. Let's rule out. Why not FAP? FAP, what is the presentation in FAP? There is more than 100 adenomatous polyps. And by what age majority of patients are going to develop malignancy? All patients develop malignancy by 40 years. So majority of patients who are coming to us with FAP, they are around 40. What is the problem in angiodysplasia? It is acquired. In elderly patients, there is loss of elasticity. So these degenerative changes are there in the vessels. Why not ulcerative colitis? Guys, in ulcerative colitis, there can be bleeding, but there is no association with what? Aortic stenosis, and this kind of appearance is not there. Why not in colorectal cancer? Again, there is no association. And in colorectal cancer, usually there is occult bleeding. Sometimes there is fresh bleeding. So what is the correct answer, guys? Again, Hades syndrome. So I hope you will not forget now. It is SCA, aortic stenosis, coagulopathy which is acquired, anemia because of angiodysplasia. Okay, guys? Anemia because of angiodysplasia. Clear? Now, this is very easy question, guys. Tell me what's the correct answer. Very, very easy. 56 years old male presented to OPD with complaints of hematemesis and melena. Patient also complains of loss of appetite, feeling of fullness in stomach. Endoscopic and further evaluation was done and the patient was diagnosed with a GIST. Clear? GIST. All of the following statements are correct about GIST except which statement is not correct. I'm waiting for your reply, guys. Tell me. Waiting for your reply. Yes. Soumya, majority of time ASGL Soumya, your answer is correct. Prince Jha, Nidhi, Rahul, Aditya Singh, Anush Sharma, Mrigank Shekhar, Dr. Jain, Priya Saha, Mahendra Vishnoi, everybody is correct, guys. Everybody. So you know that most of the GIST are positive for CD117. Clear? Carney's triad, what are the components of Carney's triad? These patients are having extra-adrenal paraganglioma, there is pulmonary chondroma and multifocal GIST. What's the name? This is Carney's triad. Clear, guys? So what's the name? Carney's triad. Investigation of choice for diagnosis, you know guys, it is not biopsy. Why we don't go for biopsy in GIST? It's a vascular tumor. So if you try to do the biopsy, tumor ruptures. So that's why. And what is the location? You can see. This is how tumor looks like. It is extraluminal malignancy. And if there is extraluminal problem of GIT, the tumor is extraluminal. In these cases, can you tell me guys, what is the investigation of choice? Yes. Investigation of choice is CCT. Clear? So it is CCT. It is not the endoscopic biopsy. Can you tell me what is the first line agent? For GIST, what is first line agent? Imatinib. What is the second line agent? Sunitinib. And what is the third line agent? Regorafenib. Guys, so first line agent imatinib, second line agent sunitinib, third line agent regorafenib. Clear? So what is the correct answer here, guys? Option C is incorrect. Endoscopy plus biopsy is not the investigation of choice. So what is the correct answer? Correct answer is C, because this option is incorrect. Clear? This option is incorrect. Okay, guys. Now very easy question. Tell me guys, what's the correct answer here? See the question. Yes, 45 years old female diabetic, known case of Crohn's disease, presented with painful swelling near anus for the last 2 days, acute presentation. She is having pain, she is having intermittent fever. Acute presentation. 1 into 1.5 centimeter mass at 9 o'clock position of anus. Mass was fluctuant, erythematous, tender, warmer. Can you tell me which of the following statement is true? First, tell me the diagnosis. Guys, tell me the diagnosis. Easy question. Tell me the diagnosis. What is the diagnosis? It's easy question. Yes, waiting for diagnosis first. Tell me. Aditya Singh. Yes, what? Anorectal what? Tell me the diagnosis. Guys, I'm waiting for diagnosis. Very good. Ritika is the first person to reply correctly. Ritika Chaudhary. Second person Rashi Gupta. Priya Saha. Easy question. 2 days history. There is fever also. Fever, obviously, it's because of pus collection. So what is the problem? Patient is having anorectal abscess. First, guys, diagnosis. Diagnosis is anorectal abscess. Okay. Now you tell me the answer. Let me see who is the genius over here who is going to reply this question correctly. Tell me, guys. What is the correct answer here? This is a case of anorectal abscess we discussed. Now tell me what is the correct answer. Yes, Dr. Maverick. Very good. Maverick, Pratyusha, Aditya Singh, crazy, midlife, peace be upon you. Majority of you are correct, guys. Wonderful. It's wonderful. Yes. See, you can easily rule out. Most common type, it is not ischiorectal. What is the most common type? It is perianal. What is the most common type of abscess? It is perianal. Next, elliptical incision. No, we don't go for elliptical incision. We go for what kind of incision? Tell me in the comment box. Cruciate shaped. Guys, what kind of incision? Cruciate shaped. Commonly seen more in female population. No, there is no sex predilection. Clear? May be caused by an underlying neoplasm. Yes. What are the causes of anorectal abscess? Mainly it is because of obstruction of the crypt. Because of that, there is infection of gland. This theory is cryptoglandular theory. What's the name? Name of this theory? This is cryptoglandular theory. This is what? This is cryptoglandular theory. Other causes apart from obstruction of gland, it can be because of Crohn's disease, it can be because of trauma, and it can be because of anal neoplasm. It can be because of anal neoplasm. So guys, you can check here. It may be caused by underlying neoplasm. Clear? So what is the correct answer? The correct answer for this question is B. It is B. Clear, guys? And Sam Kahar already told us what is the most common organism responsible for anorectal abscess. Obviously, it is E. coli. The most common organism responsible is E. coli. Okay, guys? E. coli. Next, big question. No need to worry. Just read it. Easy question. First, see, age 14 months old male child, born of consanguineous marriage. Mother brought him with presenting complaints of abdominal swelling for 20 days, poor feeding for 10 days. Child was apparently alright 20 days back. Liver was palpable 8 cm below the right costal margin in the mid-clavicular line. So patient is having hepatomegaly. Spleen not palpable. CBC thrombocytosis, can you see the platelet count is very high, 8 lakhs per mm cube. Other tests normal, normal LFT, ultrasound abdomen, solid ecogenic mass in the liver's right lobe, well-defined capsule, alpha fetoprotein very high, more than 1000 nanogram per ml, hepatitis B, C, HIV, everything is negative, liver biopsy, which is the investigation of choice, medium-sized cells arranged in solid sheets and trabecular pattern, most likely diagnosis. Guys, many clues are there. On the basis of one or two clues only, on the basis of age only, you can make the diagnosis. Most common primary malignancy of liver in children. Tell me. Guys, tell me. Yes. Pratyusha, Mahendra Bishnoi, Karan Wagmare, Rajat Bhaumik, Anush Sharma, almost everybody is correct. Mohammad Ansh, everybody is correct, guys. Most common primary malignancy of liver in children, hepatoblastoma. And hepatoblastoma, it is associated with raised alpha fetoprotein. Clear? Diagnosed by biopsy. It is not associated with hepatitis B virus, hepatitis C virus, cirrhosis or metabolic disorders. So many clues. Most common presentation of hepatoblastoma, asymptomatic intra-abdominal mass, and that is hepatomegaly. So guys, what is the correct answer? Hepatoblastoma. Let's rule out other options. Hepatic adenoma, it is seen in adults, especially in the females, associated with OCP use. Clear? And here, this kind of pattern is not there. And hepatic adenoma is not associated with thrombocytosis. In HCC, is the most common primary malignancy of liver in adults, age 6th decade, approximately 60 years. And actually hepatocellular carcinoma, easy thing, it is associated with hepatitis B virus, hepatitis C virus. Hepatic cyst, here alpha fetoprotein is not raised. Clear, guys? So what is the correct answer here? The correct answer is hepatic adenoma. It is hepatic adenoma. Next question, guys. Tell me what is the correct answer. Tell me. 61 years old female. History of ADPKD. Since 2010. Admitted with 2 months history of abdominal discomfort, rapidly progressive jaundice following nausea and weight loss. Liver function test shows obstructive jaundice. Hepatitis virus was negative. MR cholangiography, there is bilobar polycystic liver and cyst at the porta hepatis that caused marked narrowing of bifurcation of common hepatic duct. There was mild dilatation of intrahepatic duct. Which of the following options for the patient is correct? Tell me. Guys, first tell me what is the diagnosis. It is written. Patient is having polycystic liver disease. First question for all of you. In patients of autosomal dominant polycystic kidney disease, tell me what is the most common extrarenal manifestation? I am waiting for your reply. Guys, tell me. Most common extrarenal manifestations. Waiting for your reply, guys. Most common extrarenal manifestation in ADPKD. Ninja, Wasim, Anush Sharma, Rajat Bhaumik. It is hepatic cyst. Multiple cysts are there in liver. So actually speaking, what is the name of this condition? It is polycystic liver disease. So the problem, patient is having what? Patient is having polycystic liver disease. Polycystic liver disease, and you know that we don't have curative treatment for ADPKD. So if there is involvement of kidney, obviously what we have to go for renal transplantation, and the patients in whom there is involvement of liver, we have to go for liver transplantation. Now one more question for all of you. Let me see who's going to mark this question correctly. Cysts are never seen in which organ? Tell me. Guys, tell me, cysts are never seen in which organ? Cysts are never seen in which organ? In ADPKD, cysts are never seen in which organ? First person to reply, Shiva Goyal. Second person to reply, Sam, Abhay, Shalini, Kiran Wagmare. Actually, it's lungs. Guys, it's lungs. Cysts are never seen in lungs. In lungs, cysts are never seen. Okay. Now see the options. Somatostatin as an initial treatment, no. Serum calcium is low, no. It is not associated with hypertension. You know what is the most common manifestation of ADPKD? That is hypertension. Liver transplantation, yes, for progressive liver disease. So if the patient is having progressive disease, obviously we go for what? Liver transplantation. So guys, what we go for in this case? We go for liver transplantation. Correct answer is D. Correct answer is D. This is easiest image based question. Tell me guys, what's the correct answer here? Easiest image based question. Tell me what is the correct answer. Name of the fundoplication procedure in the image. What is the name of this fundoplication procedure? Easiest question. Sneha, Lily Gurlav, Rashi Gupta, Jain, Nisha, Everleen, Archana, Pankaj, Keshavi, KK, Salman, Ninja, everybody is correct. Guys, you can see here how much fundoplication in this image. You can see it is 360 degree. How much you can see here in this image? So this is 360 degree. The fundoplication is how much? You can see guys, this is 360 degree. Clear? So this is 360 degree fundoplication. Here it is 360 degree, and you know that this 360 degree is Nissen's fundoplication. So what is the correct answer? Nissen's fundoplication. See other types of fundoplication, because other types are also asked. Can you tell me what is the name of this first one? This first one, it is 90 degree anterior. Guys, tell me what's the name? This is 90 degree anterior. What's the name? First one, 90 degree anterior. What's the name? 90 degree anterior. What's the name? I'm waiting for the reply. Guys, Aditya Singh, first person to reply. Nidhi, it is Watson. This is Watson. So this is Watson. Clear guys? 90 degree anterior. Can you see the door? How much is the door? Door fundoplication, how much? Door, you know, it is 180 degree anterior. After that, toupee, you can see it is coming from posterior direction. So toupee, it is 270 degree posterior, and most commonly performed fundoplication worldwide, that is Nissen's. And how much is the Nissen's? Nissen's fundoplication, that is 360 degree. So Nissen's fundoplication, how much? 360 degree. So guys, worldwide most commonly performed fundoplication Nissen's, that is 360 degree. Can you tell me door and toupee, these are what kind of fundoplication? Nissen's is complete fundoplication. Nissen's fundoplication, it is complete, and door and toupee, what kind of fundoplication? These are partial. Guys, so door and toupee, these are partial fundoplication, and in a sense this is complete fundoplication. Clear? So these are the image based questions in relation to fundoplication. Clear? Now guys, very easy question. Can you tell me what's the correct answer? Which of the following does a successful treatment of Zenker's diverticulum involve? So successful treatment of Zenker's diverticulum. Let me see who is going to reply this question correctly. Easy question guys, tell me. This is easy question. Yes. Shiva Goyal, Aditya Singh. Aditya, most of the times Aditya Singh, you are correct. Parv Patel, Priya Saha, you are also correct for most of the times. Maggie, Jain, Akshat Arun, Bittu Mishra, Puneet Sai. Okay guys, so see, it's easy. First, diverticulopexy. In some patients we go for diverticulopexy. Yes, we go for diverticulopexy. Resection of diverticulum. Yes, we go for resection of diverticulum also. Now see the C option. either diverticulopexy or resection with cricopharyngeal myotomy. We do this observation? No. So both A, B, C are correct. Out of these three, which one is best? So actually the treatment of choice is what? Cricopharyngeal myotomy and diverticulopexy. So what is the treatment of choice for Zenker's diverticulum? It is cricopharyngeal myotomy with diverticulopexy. So actually speaking, correct answer is C. Correct answer is C. It is cricopharyngeal myotomy with diverticulopexy. Clear guys? So C is the correct answer. After that, see this question. Let me see who is genius over here and going to reply this question correctly. Nutcracker's esophagus. Which of the following statements regarding diagnostic criteria is accurate? Guys, tell me, I'm waiting for your reply. Nutcracker's esophagus. Chandni wants to ask that, sir, rapid revision QBank is enough. See, for INI-CET, since the time is less, minimum requirement is rapid revision QBank. That's the minimum requirement. So you complete minimum rapid revision. Simultaneously, if you have difficulty in some subjects, do the main question banks from main videos also. And best thing, try to finish this QBank 6.0. Clear? Minimum go for rapid revision QBank and at least try to finish it. Right? So guys, let me see. Pankaj Agarwal, Shivam, Shivanya, Sim, Dr. Imranul Huda, Vaishnavi, Bhavya. So guys, majority of you are correct. What is the diagnostic criteria? Diagnostic criteria for nutcracker's esophagus. You can see this is the amplitude of contraction. How much should be the amplitude? Amplitude of contraction should be more than 180 mmHg. And how much should be the duration of contraction? More than 6 seconds. Clear? So amplitude of contraction more than 180 mmHg, duration of contraction more than 6 seconds. So you can see amplitude of contraction more than 120. This is for diffuse esophageal spasm. Duration of contraction more than 6 seconds. Duration of contraction more than 4 seconds. This is incorrect. Amplitude of contraction more than 180 mmHg. Okay guys. So what is the correct answer? C. Correct answer is C. So one question for all of you. Can you tell me what is the most common motility disorder of esophagus? Guys, tell me. It is achalasia cardia or nutcracker's esophagus? Most common motility disorder of esophagus. Tell me. Most common motility disorder of esophagus. Yes. Vivan. Very good, Vivan. Very good. Par Patel. Everybody is correct, guys. It is achalasia cardia. Most common motility disorder, most common hypomotility disorder. It is achalasia cardia. Most common hypermotility disorder, that is nutcrackers. Okay. Next, guys, is easy question. Tell me what's the correct answer. 40 years old female, known case of proximal cholangiocarcinoma, underwent PTBD, percutaneous transhepatic biliary drainage. Patient's bilirubin level was very high. Bilirubin was very high. After the procedure, patient developed abdominal pain. On further evaluation, she was found to have hemophilia because of iatrogenic trauma to the biliary tree. Best related to hemophilia. Which of the following statement is best related to hemophilia? Let me tell you guys, answer is also written in the question. Yes, answer is also written. Aditya Singh, Muhammad Anas, Nidhi, Naresh Kumar, Jaya Bajpayee, Midlife, Shalini, Sim, Abhay, Amit Kumar. Almost all of you are correct, guys. So see, tell me first, what is the most common cause? Answer is written. The most common cause, it's not the tumors. What? It is PTC, percutaneous transhepatic cholangiography, or PTBD. It means what? It is because of iatrogenic trauma. What is the most common cause? It is because of iatrogenic trauma. Clear, guys? Primary treatment of severe hemophilia. Hemophilia. How to remember, guys? See, you will not forget throughout your life. Hemo. Can you see? Red colored, hemo, bile, green colored. Bilia. So what is the problem? Can you see? This is happening in hemophilia. Now you will not forget throughout your life. Hemo, blood going into bile duct. So whenever blood is going into the bile duct, it is going to clot. Because of clot, patient is having colic. Clot colic means abdominal pain. There is obstruction, patient is having jaundice. And because of bleeding, upper GI or lower GI hemorrhage. Can anybody tell me what's the name of this triad? Guys, tell me. Triad. Dr. Imranul Hoda. Quink's triad. Very good. Sandblom's triad. Prajwal, Pratyusha. Prajwal, very good. So it is also known as Quink's triad or Sandblom's triad. Clear? So what are the components? There is clot, colic, jaundice, upper GI or lower GI hemorrhage. Okay. So since bleeding is there, investigation of choice is angiography, and how we manage easily angiography with embolization. So majority of patients can be managed conservatively or by embolization. Ultrasound reveals a specific diagnosis? No. And you can see here, guys, what is the classic triad? Yes, so the classic triad is upper GI, upper abdominal pain. There is upper GI hemorrhage and jaundice. What's the name of this triad? You already know name. This is known as Quink's triad, also known as Sandblom's triad. So what's the name, guys? Quink's triad, also known as Sandblom's triad. Clear? So this is Quink's triad, also known as Sandblom's triad. So majority of you were correct for this question. Okay, guys? Majority of you were correct. Next question, easy. See, 4 weeks old male baby brought to the casualty by parents. What's the complaint? Complaints of recurrent episodes of non-bilious vomiting. Child refuses to take adequate feeds. Child is hypotensive, tachypnic. Ultrasound abdomen reveals feature consistent with hypertrophic pyloric stenosis. Most likely associated with this patient. Guys, tell me what's the correct answer. This patient is having hypertrophic pyloric stenosis. Nisha, KK, Sajawar, Naresh Kumar, Abhay, Medlife, Amit Kumar, Pankaj, Ritika Chaudhary, Mahendra Vishnoi, Shiva Goel. Everybody is correct, guys. Everybody. First, can you tell me, it is acquired condition. What is the age of presentation? Not after 13 weeks. After 4 to 6 weeks. Presentation, guys, it is after 4 to 6 weeks. It is first-born male which is most commonly affected. What? First-born males are most commonly affected. Visible peristalsis is always seen. No. In majority of cases, you can find visible peristalsis, but not always. Let me tell you one clue related to MCQs. Always and never. Whenever you will find the term word always and never, most probably this statement is incorrect. Always and never, the statements which are having always and never, in majority of cases, the statements are incorrect. So what is the treatment of choice, guys? It is Ramstead Friedet pyloromyotomy. So what's the name? It is Ramstead Friedet pyloromyotomy. Guys, Ramstead Friedet pyloromyotomy. Pyloromyotomy, that is the treatment of choice. Ramstead Friedet pyloromyotomy. Clear? So correct answer for this question, it is C. C is the correct answer. Next. Again, easy question, guys. Tell me what is the correct answer here. Tell me, 55 years old male brought to the OPD with complaints of hematemesis and melena. Patient has history of chronic alcohol consumption and smoking. Clinical features suggestive of upper GI bleed. Which of the following is a component of Blatchford score for risk stratification system for upper GI bleeding? Let me see who is genius over here, who is going to reply this question correctly. I'm waiting. Aditya Singh, Shivanya, Claire Maria. Yes, only 3 people till now. Only 3. Only 3 people. Ninjas. Ninja, Shivanya, Mansoor Patel, Kiran Wagmode, Prem Panpalia. Yes, Prince Jha. Guys, there are 2 scores. One is Blatchford score and the second is Rokal and Baylor score. Both of these are important. These are the risk stratification system for patients of upper GI bleeding. Have a look. Easy to understand, easy to remember. First, see the Blatchford score. Clear? How to remember? First, you have to remember the mnemonic push. Push. Clear? P means pulse rate. U means urea. So which urea? Blood urea nitrogen. S systolic blood pressure. H hemoglobin. So it is push. Apart from that, what push? What? Push melena syncope, hepatic or cardiac dysfunction. So push. What we have to push? Melena syncope. Push melena syncope, cardiac or hepatic dysfunction. So pulse rate. U urea, blood urea nitrogen. S systolic blood pressure. H hemoglobin. Clear? And presence of melena syncope, hepatic or cardiac dysfunction. Clear? After that, guys, there is Roccal and Baylor score. How to remember this Roccal and Baylor score? The mnemonic is CAS-D. It is CAS-D. CAS-D. So C means comorbidity. What kind of comorbid disease patient is having? Cardiac, renal, disseminated. A, age less than 60, 60 to 79, more than 80. S, shock. In patients of shock, how much is the systolic blood pressure? Less than 100. Pulse rate more than 100. So patient is unstable. D, diagnosis at the time of endoscopy whether patient is suffering from benign disorder or malignancy. E, endoscopic stigmata of recent bleed. So CAS-D, C, comorbidity. A, age. S, shock. D, diagnosis at the time of endoscopy. E, endoscopic stigmata of recent bleed. Clear, guys? So you can see here, age, it is the component of CAS-D. A, age. S, shock. Endoscopic stigmata of recent bleeding. D was diagnosis. Clear? C was comorbidity. And here it was push. For Blatchford score, it was push. Clear, guys? So it was push, that is pulse. U means urea. S means systolic blood pressure. H means hemoglobin. Okay, guys? Clear, guys? So this was Blatchford and Roccal Baylor score. Clear, guys? So these were the questions. So thank you very much. Majority of you are doing good because I can assess most of you are marking correct answers. So keep the spirit high. And let me tell you, since the exam is announced, exam is in the June, I'm telling you on basic psychology of students. I saw two kinds of students. Suppose the first student who is going to start the preparation like this. From the first month only he is going to start the preparation, and can you see this is the preparation. But whenever exam comes closer, these students, yes, they become reluctant when they feel like that, yes, I'm doing good, right, my scores are good, so they become reluctant, and after that what, they are not putting 100% of their preparation. Some of the students, what, they start a bit late, but what happens, can you see, in the beginning what happens, they are going to put their 100%. So preparing for any kind of entrance exam is just like a marathon. Initially you start slow, but whenever you are very close to your goal, yes, very close to the end point, what, put your 100%. Yes, give your maximum, increase your speed, and if you are feeling a bit reluctant since the dates are announced, what, put your 100%. Devote 8 to 10 hours minimum per day. Study hard, and let me tell you guys, nobody can stop you. Definitely you are going to crack the exam with flying colors. So our best wishes with you. The whole PrepLadder family is with you. We are there to help you. Clear? Keep studying, keep rocking. Best of luck, guys.